Oh, that's fine. Well, there is the speaker right.
We are
above us, but
competing with
that's
JJ.
fine. It's a hell of a competition, well and truly, but we can do our best.
All right. Next question.
Mm-hmm.
If a patient has false teeth, do these get removed during surgery or anesthesia?
That's a great question.
That is a good question.
I would say, and for me, it very much depends because false teeth they help fill out the mouth and sort of reduce the sunken cheeks, and we find that very useful when face masking and sort of breathing for someone using just a face mask. But at the same time, when we need to go a little bit deeper and sort of pop a tube in, or sometimes it's a bit variable, sort of put an LMA in and things like that, they get in the way. So
Yeah.
as a general rule for most procedures, I'll probably tend to take them out unless I really want to rely on the face mask, in which case I'll leave them in.
Yeah.
Would you do the same, or are you always out, always in?
I tend to be more an always out kind of person, and I do talk about that with patients, so I do warn them. And it depends on the false teeth. Like I'm thinking dentures here.
Yes.
I know people have implants and sort of all other sorts of false teeth. Obviously, if they're stuck in with metal, rods,
If it's not coming out, it's not coming out.
They're not coming out. They're certainly not coming out. But yeah, so I often warn patients that yes, I'm going to need to help give them some oxygen to breathe. There might be a breathing tube going in because I don't want to damage their dentures. I would prefer to take them out. It often happens, and I know some people are like, oh, don't look at me without my teeth. So I often say, we'll do it while you're asleep. You don't know about it. They come with you. We put them in a little pod. It's labeled. We don't want to lose them because they're really expensive. Sometimes they're glued in.
I haven't encountered that too much nowadays. I always ask the question, but it's only been once or twice that they've been glued in, which is quite hard to get off.
They're not, hard but not impossible. So it always depends. It depends how much I'm having to, what we'd say, instrument the mouth. So whether how likely it is I'm going to be putting breathing tubes in and things like that. There's been the odd report of dentures being kept in and then coming loose during the anaesthetic and getting further down, like maybe even swallowed. So that's one of my big motivators for taking them out, because then I know where they are.
Yeah, that's very fair. Yeah.